Welcome to Season 7 of Wellness as a Way of Life for Women Building the Future. I'm Megan Swan, wellness coach, consultant, and strategist, here to champion visionary women who are shaping tomorrow. This season, we dive into holistic wellness practices, mindset shifts, and real life stories from women who are leading change in tech, entrepreneurship, and beyond. My mission is to help you integrate wellness into every facet of your journey, so much so that it feels like a way of life. So you can show up as your most vibrant and impactful self. You can be a part of the movement by subscribing to my Substack for exclusive wellness tools, inspiring interviews, and a thriving community of future builders. There is a free and soon to be paid option launching this fall. And if you enjoy this episode, share it with a friend who's building the future too. Welcome back to the podcast. I'm so excited to interview my friend today, Maureen Codispodi. She is the founder and director of Health Clinic Canada. It's a force of change in the landscape of mental health support in Canada. Can't wait to dive into the ins and outs of it. As a seasoned mental health and education professional, Maureen is committed to breaking down barriers to mental health services and, with the support of her team, is making an impact in the lives of Canadians. Welcome, Maureen. How are you this morning?
I'm great, Megan. How are you? It's so good to see you.
Yeah, I'm excited for this. So let's go into a bit of the origin story. Like, how far back has this been percolating in your mind as something you wanted to start?
That's a good question. Sometimes people say, "So when did you start the company?" And it's like, well, it began much longer ago than that. So, um, to be honest, I think I've been percolating this idea for, I don't know, probably since 2009, when I cycled across Canada solo. So it started percolating then because I realized like how spread out this country was and how sort of diverse it was and how many small communities there were. Like it's easy to forget when you live in a big city, but Canada is just so expansive and there's just so many little nooks and crannies along the way that I realized, hey, it would be cool to get some, connection in this country because it sometimes feels so divided. And then I retrained to become a therapist a few years ago. So I've worked in mental health, I've worked in education for many years. And um, I think it was before I even retrained that I realized this was what I wanted to build. And I think in some luck and also not, the COVID sort of changed the landscape of this idea for me because I had this idea long before COVID sort of made Zoom possible and made online therapy sort of well known. I had run a part-time coaching practice from overseas and always connected with clients this way. So I knew that it was possible. Of course, now online therapy, everybody knows about it. A lot of people are a lot more comfortable with it. And yeah, so here we are. We just celebrated 1 year anniversary of having our doors open. So it's pretty exciting
Woo!
times. I know. I know.
Congratulations. Well, it's
Thanks.
incredible traction for only a year of officially being in operation.
Yeah, pretty exciting.
So, can you walk us through a little bit more of the nitty gritty? Like, who are you serving? How do you sign up? Is it open to everyone? Those kind of things. What
Yeah,
is it
absolutely.
exactly besides online therapy?
For sure. So, we like to call ourselves an online mental health platform because we have a lot of ideas for expansion. But right now, what we offer is sort of what we call full fee therapy. So we have registered therapists across Canada in almost every province except Quebec, where we offer therapy to people um, in all of those places. And usually that's for people with extended health benefits or who can afford to pay out of pocket for the therapy. And then we also run a low fee program, and that is run through our master's student therapists. So we have many student therapists who are absolutely amazing, and they allow us to operate and only charge clients $25 per session. And both programs are gaining a lot of traction. And so there's a low barrier to the $25 an hour therapy. So there's a really simple application, and we sort of take anyone, and it's very honors based, and we're not digging into things too much, but we just trust that people know that that's what they need. And then slowly we're building up connections with other external agencies so that if people can't even afford the $25, we have a referral network in place to send clients where they could possibly get free therapy. So we're working on that across Canada, but of course that takes time and building relationships. So those are our the two main things that we do. We also, offer customized psychoeducation packages to different institutions. So we've been partnering with different organizations and finding out where their gaps are and supporting them with those. And one of the most exciting things that we did this year was partner with a school in the Northwest Territories, where we were able to offer low fee therapy through Zoom to their students, or counseling to their students in their schools, because they had no one. So we're building that relationship actively, and ideally we'll be in a lot more schools next year. So we're really excited about that relationship.
So many goosebumps. And so you do serve youth? I mean, if you're in the schools, or is there an age limit?
We do serve anybody. So we could serve young people and youth, definitely. We do have a few situations, and it's kind of case by case, where we do offer online therapy to children, but usually those are very specific situations, and we have a little bit of criteria that people need to meet to make sure that they're suitable candidates. But oftentimes that comes to be because there's no other option for those young people. And we definitely serve youth, and then up to adults. So the whole spectrum.
So now, as a tech founder of sorts, like what were some of the barriers that maybe surprised you, or that you're proud of yourself for overcoming?
Uh, well, so my company is technically called Tech Enabled, but I am not a techie. I am not, I don't have a background in business. I don't have a background in anything technical or online or any of that. I am a fast learner, but I didn't come with those skills. I have many skills which are not that. And so some of those barriers were probably different for me than they are for other founders, because I was sort of learning on the fly. I think, there is the online space is very crowded, and understanding who to partner with, or who to hire, or who to get support with as I was building it definitely was a huge learning curve, and I made some mistakes there for sure. But I am very proud to say that, the people that I am working with now, both in like marketing and in other spaces, we have great working relationship. They're very aligned with what we're doing, and they're helping us move forward. But that takes a lot of time. And I think, one of the things that I've learned, which was fascinating to me because I work in a female dominated profession, is that many of the bigger companies, especially with mental health, are still male founded and male led. And so I'm a little bit unique in that space for sure. I know there are a few other amazing organizations that are led by women, but mainly when I go to conferences and meet other businesses like myself, it's men that are leading them. So it's a very interesting dynamic for sure. And I think, I think there's definitely a space for our clinic in the landscape of Canada, and I'm proud that we are female founded for sure.
Yeah, incredible. And so can you dive into that a little bit more in terms of, the vastness of the problem, that there's definitely space for multiple companies solving it?
Oh, yeah, and so there is this like mindset amongst therapists, amongst the landscape of therapy, that like there's a scarcity mindset, that there's not enough clients. But in actuality, when you look at sort of, even, bigger group practices, and which is kind of what we are. We're like a bigger group practice, and we've positioned ourselves to be cross Canada, but essentially that's all we are. And when you think about what it takes to be successful, depending on how many clinicians or independent contractors you have on your team, um, somewhere between 300 and 600 recurring clients every week is a reasonable profit for companies. And so when you think about the population of Canada and you think about those factors, like it's not a huge number. And I think it depends on the company and how many clinicians they have and how many clients they see. But I think reasonably, it is a very small number of people that you need to be successful in this industry for sure. And there is enough clients to go around. That's absolutely true.
Yeah, and I'm guessing that you probably have this somewhat unique thread of really trying to reach out to communities that are dramatically underserved and building relationships where other people might not.
Absolutely. Yeah. And I think that's one of the things, like we are in the space with other companies. A lot of those are city-based or big city-based companies. Well, they do serve, you know, like the whole provinces or across Canada. They aren't necessarily marketing themselves to those smaller rural communities, which is sort of where we're looking. We do serve still people in cities, but um, building those relationships with organizations and doctors and different people that are serving people who see they need help. That's where our referrals come from, for the main part. And yeah, we do have a lot of our clients from very small communities across Canada. So it's really interesting when I do intakes to learn where people are calling in from. Yeah.
That's incredible. I would love if you could share, like, going back to, creating something and not being a business expert, not being a tech expert. What would you say to a potential future founder who's an expert in their own zone of genius, but wants to build something and feels like they kind of need to go through these mindset hurdles of, I don't know how to do that.
Yeah. I think get really clear on your vision, know what you want to build, and seek out mentors, seek out networks of people that can support you. Like there's some amazing female entrepreneurial organizations in Canada. Go to them, find people, ask advice. Yes, I didn't know a lot of business things, but I asked for help. I got support from other founders. I asked support from people who don't like who are experts in their field. So um, I have an amazing fractional CFO that works for me, for example, who does a lot more than just numbers for me, and so she helps support me. And so i- if I didn't find her, I don't know if I would be where I am, because she's very aligned with what I'm up to, and she has a skill set that I don't have. And so it's amazing when you start putting yourself out there. I think you end up meeting a lot of people, but don't be afraid to say, like, this isn't quite the right fit. Trust your gut, trust your instincts, and the people that are meant to, you know, support you with your business will align, and it will feel easy. It will feel right. Not to say that the people that I work with don't challenge me. They do, but that's why it works for me, because I find people that don't think like me, that have different ideas and have expertise that are not mine, and are not afraid to ask questions or challenge me, or get me to think about something different. And, you know, I think my learning curve, I don't know if it's a curve, but like a straight line up has, but that's okay. And I think, yeah, if I could wave a magic wand and start again, yes, would I do things differently? 100%. But I think ultimately, what it boils down to is, like, the mistakes that I made were not trusting my gut enough. I am a person very in tune to that, but I was just sort of like overwhelmed with all the things. And so if I had sort of trusted my gut in a few instincts or in a few instances, I think my path would have been a little bit different. But here we are, and I'm really proud that the growth that I've managed in a year, being a first time founder, being a first time in business, all of those things, it's incredible when I stop to look at the reality of what I have built, and the foundation is there. So there's no doubt in my mind that we're gearing up for huge growth. So it's really exciting. I can't even believe it sometimes when I process all of it. I think, oh, I actually did that thing that I said I was going to do. How cool.
I
Yeah.
love that. So, can you paint a little bit more of a picture? Insinuated that there's a lot of, bigger added layers that are going to come on to this project, this platform. Can you tell us a little bit about your vision, like 5, 10 year vision for it?
Yeah, absolutely. I have a lot of ideas, so I don't know if all of them will come to be, but I think one of the definite things that we want to do is we do want to eventually become two organizations. So we have our profit organization and our nonprofit organization. So like the student program that we're growing right now, we could definitely turn that into a nonprofit so that it's still um, has a safe place for student learners like the student therapists, and growing that while, not taking any money from it. And so that supports like all of the learning that the students need and their supervision and all of that. And then running our for-profit company. So that would be definitely one space. We also, want to grow in terms of what our offerings are online, and become a space where people can come to access learning, access a community, that sort of thing. So it does take a lot of work in the background, and we do have a few courses that are all internal, but we, eventually will grow to a space where we can offer, asynchronous courses to people, online trainings, that sort of thing. And so those are the two main, I think, places where we're looking to grow and looking to pivot. But, ideally we will stay true to being online therapy and just being a resource for people online. We do have an online resource data bank on our computer where you can search up what resources are available in your community, but we haven't sort of like fine-tuned it, and it's a little rough around the edges, but it's there. And so, optimizing that is definitely a priority as well.
Hmm. So let's say that you're a principal listening to this. Is there a way that specifically, a small community or a school or another sort of organization in a bigger city wants, kind of to promote you as a great option? What would you suggest? Do you want them to contact you directly, or do they go to the website?
Yeah, no, I think we sending an email to our inquiries email or just coming on our site, and you can see our contact there. We do have a team of amazing interns who help with all that community-based stuff. So if, they're sort of like our front line, and they'll take any inquiries and then support with giving access to information, whether it's a digital flyer or we mail out actual flyers to put up and to promote in that way. Or we've also had it where some of our students and me at times where we've like done little mini info sessions for their community, so they learn about us in that way, and they're able to ask questions openly. But it's definitely case by case, and whatever questions people have or whatever types of partnerships they're looking for, then we try to create a solution for the problems that they're facing and figure it out together. And that's how that Northwest Territories counseling option became available, because the principal reached out to us and she said, I have this gap, like what can we do? And we put our heads together and we figured it out. And last week I met with their superintendent, and we're looking at working in a few more other schools next year. So it started small and we piloted it, and it's working, but it's about just like getting in connection and creating those relationships with people, and figuring out solutions to problems together. I certainly am not over here saying, oh, I know all the answers to all the problems, but yeah, whatever problems people are facing in terms of services or supports, they usually will contact us and we creatively figure it out.
Hmm. So you and I are deeply in this mental well-being space, so it doesn't seem taboo to us, but is there still some of that stigma associated with getting help? And is part of your role going to be in educating people that they need you and that you're an option?
100%. Yes, there is. I think it is changing. I think I'm learning that it's changing by the demographic of the consumer that's coming to us for therapy, whether it's full fee or low fee. It's pretty amazing because I know some of those populations, have grown up with stigma, whether it's like an older population or, you know, just depending on where they are geographically in the country. And um, sometimes there's like stigma in smaller places because there's like not as much access and not as much information, and so people are less likely to get support when they need it. And I think that I every mental health professional, part of our job is to do outreach and education and sort of get the message out as to why getting support is okay and also needed. And you know in an ideal world, we all have the support that we need and we do it proactively. Unfortunately, we're still in mostly a reactive phase, I would say, in our country and in our provinces. I think for the most part, people are more reactive when it comes to therapy, but I think it's changing based on the demographics. But I certainly, one of the best things that I can do is when I hear a new client say, like, I've never done this before and I'm willing to give it a try. Or when I get feedback from clients like, oh, that therapist was such a great match. I am so glad that I took a risk and I tried it. And thank you so much for supporting me on this journey. And I think that to me is like the best compliment ever, when somebody tells me like they've done it for the first time and they're so grateful. And I think the more that we get that message out there that it's okay to sort of ask for help, it's okay to talk to somebody, and it's more than okay. It's important to talk to people, and that it's not the same as, calling up your friend when you have a problem, because talking to a therapist, they're only there for you. They don't have, an outside agenda for you. They don't know your history. They only know what you tell them. And so they're not sort of seeing you through an old lens or an old idea of who you were, but they're promoting who you want to be and what you actually want. And so having that non-biased person support you, and obviously like bring their background and education and tools to that, is amazing. But it's so important to know that it's confidential. So everything you talk to a therapist about is confidential, and it is safe, and you can get the support without feeling shamed. And it's very different than talking to a friend, that's for sure. I may feel like it at some times, and that's good because you want a good relationship, but it's not the same.
Mm. And I love that you highlighted that. I would love if you have I love that you really emphasized, leaning into your intuition and, following your gut in those decisions where even when you feel like you're not in your own expertise, that is a good source of guidance. Any other advice for founders?
Hmm. Yeah, I think I said it before, but like that community piece and that connection piece cannot be understated. I mean, even just speaking to someone like you, Megan, right? We met at a conference, right? And now, because of you, I have this person on the other side who, like you said, well, you have similar values, we have similar beliefs. Like we're already, we believe the same thing. And how do we help each other? And you have expertise that I don't have, and I wouldn't feel embarrassed to ask you because now we have this relationship. So don't be afraid to build new relationships with new people so that you can support each other. And you'd be surprised at times where you feel like, oh, is it only me, or should I be embarrassed for this or whatever? And when you just like put it out there, you realize, oh, I'm not alone. I'm not alone in this struggle, and this is hard, and it's okay if it's hard. And I have people out there that will champion me. Without that network, without putting myself out there to build those networks, I would probably have given up by now because I would have been so isolated and alone. The work I do is already tends to be very isolating because I still do take clients. I, have a practice. I work with people one-on-one, and then I'm remote. I'm on a screen, and so networking and building communities and finding people that align with you is so important. And I mean, if we tell our audience, the reason that Megan and I met is because we were trying to struggle to get an early morning coffee when we were both really tired at the beginning of the day at this conference. And we connected almost instantly over our, shared desire to get that coffee. And I think, it's sometimes those small moments that lead to great relationships. And so, don't be afraid. Don't be afraid to put yourself out there.
Mm. Well, thank you for that. And I totally agree. Like, it's just, it can be really isolating. I actually wrote a post the other day about, I feel like there's a lot of similarities actually between entrepreneurship, particularly as a woman, and then motherhood in terms of how it's isolating. And there's like so many of us doing the same thing, but there's this fear that you have to be humble and you don't want to help other people. Like, you're not sure what you're doing in this area. And but it's I've honestly never had a bad experience putting myself out there. And if that person doesn't want to be that person or can't help, I'm sure they know somebody who can, or the community that you need to talk to.
Exactly. Yeah, that's such a good analogy, I think. Yeah, motherhood and entrepreneurship are so similar. So many variables that you cannot control, and your self-esteem takes a hit every once in a while, and you're not sure who you should ask for help when. And often you're like way down the rabbit hole before you ask for help, even though you should have asked for help like, yesterday or whatever. So yeah,
Yeah,
totally.
yeah.
That's funny.
Well, this was amazing. Thank you so much. We'll share all the links in the show notes. Is there anything specific you want to highlight for people to go to other than the website?
No, just come to our website. I guess LinkedIn is always a great place to find me and to find us. I really enjoy connecting with people on LinkedIn for sure.
Beautiful. Well,
Yeah.
thank you so much. And, we'll definitely be in touch.
Yeah.
And this was a really great conversation. Thank you so much for sharing your experience, your wisdom.
Thanks, Megan. Thank you. Great to be here.
Thanks so much for tuning in to Wellness as a Way of Life for Women Building the Future. I'm Megan Swan, and I'm honored to support your journey to well-being and leadership. For more insights, resources, and connections, subscribe to my Substack through the link in this episode. It is your go-to hub for wellness strategies, and there's free and premium content. Let's keep building a brighter, healthier future together. Until next time, take care and lead well.